I've been speaking to people all over our borough on what the NHS means to them, and it's heartrending and moving. People of all ages and all backgrounds realise just how important and precious healthcare, free at the point of need, is.
So we're still out here on the picket lines for another round of action, the first day of joint action with our consultant colleagues. The reason we're here is because the government still hasn't recognised our concerns, not only about pay, but also about the general conditions of the NHS, about how it's becoming more and more difficult to provide the level of care that we want to provide for our patients. And although we are striking about pay, it's also about a recognition that the NHS won't survive in the future if we don't value our staff, not just doctors, but also all of our colleagues across the multidisciplinary team, including nurses, physiotherapists, cleaners, security. Across the board, we're losing staff, we're not being able to provide the service we want to. Unless that improves, we're worried the NHS won't have a future.
So what's the stress levels like for you at work? I mean, do you get a time for each patient, or do you have a lot of patients piled up and you've just got to do it?
Yeah, exactly. So for junior doctors and consultants, I think one of the things that really affects people's mental health and affects how people feel about their work is the fact that you can't spend enough time with each patient. We know that by the time we see patients, often they've been waiting too long. People wait for hours in A&E, people wait for weeks to see a GP, months to see a specialist, and then by the time they're getting the care that they need, their disease or health condition is much further along and harder to treat than it needs to be. And that does affect how people feel. And that's why people are leaving the NHS, not only to work in other sectors in the UK, but also to working in health abroad, because they want to work in a system where they feel valued, but also they're able to provide a level of care that they feel proud of.
Do the patients that have had a long wait to see you from A&E, for example, do they understand the pressure you're under, or do they just feel very aggrieved?
The response we get from patients, not only on the picket line, but inside the hospital as well, is overwhelmingly positive. People recognise that staff are working hard in very difficult circumstances, and they can see from being in the hospital that it's difficult circumstances, that there's more patients and less capacity than there needs to be. Of course, sometimes patients get frustrated, and we understand that, and that's another thing about being a frontline worker in the NHS, is that sometimes you have to deal with people who, in a very difficult situation, do become aggrieved. But generally, the atmosphere amongst patients is very supportive. They recognise that the system has to change, it's not the staff.
And for those that can afford it, to get past queues, they buy their way past it by going to private medicine. But I guess the majority of patients here have no option other than the NHS, do they?
Exactly, and there's a misconception that paying for private healthcare eases the burden on the NHS. Actually, as we know, you're competing for the same resources, and it's a matter of moving up the priority queue rather than adding capacity. So, but most, especially in this area, but across London, a huge percentage of people have no option but to use the NHS, and the option of using the NHS is becoming less and less effective for them with every passing week and month of government underfunding.
And what's the sort of staff turnover like here at the Whittington? I mean, you've got obviously doctors like your good self, but also all the other very important jobs people do, like cleaning, catering, physiotherapy and so on.
I mean, I think the truth is that it's getting harder and harder to retain staff across clinical specialties, so across medicine, nursing, physiotherapy, radiology, you name it. People have been out on strike, people are unhappy with their conditions. It's getting harder to retain staff. People are moving to Australia, New Zealand, now the Middle East as well. And it's the same in non-clinical staff as well. And I think the thing is that many people like me want to work in a public health service. We want to work in a health service which is free at the point of use and available to all members of our society equally. However, the conditions and also the pay are driving people away, even people who wish to work within this service. And personally, I would hate to leave the NHS. I think it's a fantastic system. It just needs to be funded properly.
And do you have dealings with the private operators within the hospital, such as services that are being contracted out? Because it seems to me there's a big problem with the Health and Social Care Act encouraging an internal market, which means services are differently managed.
Absolutely, and that's where I recognise that as doctors we're actually relatively fortunate compared to some of our colleagues in the hospital. Many security, domestic staff are employed by external companies who don't provide pension, don't provide sick pay, and that's shocking. During COVID I was working with a porter and I tried to nominate him for an NHS award because he'd been because of the work that he'd been doing during COVID. And then I realised that you needed an NHS email address for me to nominate him, which meant that I was unable to nominate him because he wasn't employed by the NHS, didn't have an NHS email address. And I think that's just an example of how people are being disrespected, not valued. And yeah, it's something we've ended up with a two-tier employment system within the NHS.
Now, what's the mood like amongst your colleagues, the doctors who have now been in this dispute for a long time, and we've all been very pleased to be here supporting you, but what's the mood like inside?
The mood is resolute. We reballoted towards the end of August, and we got an even higher turnout and even stronger votes to continue industrial action. So the mood is resolute, but it's also deflated in the sense that none of us want to be out on strike. I enjoy my work. I want to be in the hospital providing care for patients, and we do recognise that this has a knock-on effect to things like waiting times. However, we believe, those of us on strike believe, that this is necessary to protect the long-term future of the NHS, that ultimately patients are suffering because of the degradation of services that we're witnessing and because of the lack of staff, the inability of the NHS to retain staff. So resolute, we're going to continue until the government makes an acceptable offer. However, also sad that it's continuing to be a situation where we're unable to be in the hospital doing what we want to do, which is providing safe, good quality care for our patients.
Can I say on behalf of a lot of people around here, thank you for all that you do, and thank you to all the staff at the Whittington. It's a hospital that's been on the danger list at various times. We've always survived, we've always kept it, and I hope you win.
Thank you very much for your support.
Always.